So, ma'am, the biggest question that comes up, or which I want people to get an idea on, because everyone's like, we don't want to do an MDS, so we'll just go ahead and do an MPH, which is something which I don't think is the case, and I want to like disrupt that basically. So, why did you in particular decide to do MPH?
I think my main reason and what I tell everybody else is follow your interest and follow your passion. For me, it was that I realized during my internship that my true interest did not lie in dentistry, and that is not what I wanted to do with my life. And I think finance wise, it also wasn't the most feasible option for me. So I researched options and career options post BDS, went through curriculums, job options, job prospects, and shortlisted a lot of paths that I could take. And then the one that interested me the most was public health. And that is why I decided to go ahead with public health. This field in particular is very vast, and the thought of the many possibilities kind of excited me as well. So I think that was my decision point. I think everybody, when they make the decision, should focus on what their interest is and where their passion is.
That makes a lot of sense. And to add to that, just don't take it just because you don't want to do MBS. Like you said, like you researched, you shortlisted. I think
Yeah,
that is one of the most important things that people need to understand, that that is something that you have to do more than anything else. So,
definitely.
ma'am, why did you decide to pursue an MPH from Canada, not any other country, not India? What were the major driving factors behind this decision?
So just to get into the global landscape of it, currently for public health and global health, Canada, UK, USA, and Australia are the four options that have excellent programs and excellent future job prospects. So I was looking into these four countries initially. And then I zeroed in on Canada just because of ease of migration, gaining a work visa after studying, the cost of living, cost of education, just the geopolitical landscape, and how accepting a country is with respect to immigrants. For example, will I face racism or any such issues if I go into a different country? Will the people who are native to that country be accepting of me? So, Canada, in that way, is way diverse and way more accepting. And I think that was one of the decision points, I think. Yeah.
That does make a lot of sense because already there is so much that you have to work through. कि उसमें added cultural influences and all of that. So your
Yeah.
main motive was to do an MPH from outside so that you could settle outside, right? I mean, do
My main motive was actually to study global health. In public
okay.
health, you have global health. So I wanted to study global health. And in India, currently only Manipal University offers global health. There is no other college, no other course. And that is a very small pool of colleges to choose from. So which is why I decided, okay, if I don't get the education that I want in India, then I need to look outside. And and then I researched the different countries on where to go and how to go.
So, ma'am, if just a side question, which is not, the usual questions that I generally ask, but if, let's say, you've done global health, so can you also use your expertise, what you've learned in different countries? Like, can you also come back to India and work? Is that a possibility, or it's just limited to Canada?
So global health looks at this field from a global perspective, and it is not country specific. Okay,
Right.
so just because I have global expertise does not mean I will have country level expertise. Global health is more of collaborating with the people who are already in these countries working on those issues. So you collaborate with them, you work with them um, rather than going into that country and working there.
Right.
So the collaboration part is very important. You are not doing the work for someone. You are not establishing something for them and then leaving the country. That's not what you're doing. You are helping them create a sustainable health system that can continue afterwards as well. So you need people who are working there already, and you need to collaborate with them. So would my expertise matter in India? Well, I'm not sure if I have the country level expertise that I need. But at the same time, I have been born and brought up in India. I did my internship prior to going to McGill. I did my internship in India, so I understand the context well. As part of our medicine and dentistry, we did go to camps, to public health dentistry camps. We did go to remote areas, and we have seen what the health in general, the overall situation of health is like. So I think for us going to India, going back to India and working wouldn't be that much of an issue. But going to another country that is not India, that would be a huge question mark. I don't think the country, the people, the program would be as accepting, and I don't think I would be able to contribute as much because I don't understand the country level factors.
Right, right. That makes a lot of sense.